Hello, I'm Dr. Mugdha Raut, a gynecologist and a clinical reproductive immunologist, and co-founder of Dr. Raut's Center for Reproductive Immunology, India's only dedicated center focused on immune-related causes of infertility, pregnancy loss, and IVF failures. We at Dr. Raut's Center for Reproductive Immunology treat couples with unexplained repeated pregnancy loss, unexplained IVF failures, and unexplained infertility with the active immunomodulation, Imulate, which is our patented and branded process, and other passive individualized reproductive immunomodulatory treatments. We have our centers in Mumbai and many other cities in India. Today, I want to talk about something that many couples going through IVF silently struggle with. And that is this question: Doctor, I have already had 2, 3, sometimes 4 failed IVF cycles. My doctor is advising another IVF. Should I go ahead? Now, if you are in this situation right now, you are probably feeling confused, anxious, and under pressure, because every IVF cycle is not just a financial investment, it is also an emotional investment. You want to do whatever gives you the best chance of success. But before you say yes to another IVF cycle, there is one very important question you need to ask. Why did the previous IVF cycles fail? Many times when couples come to us after repeated IVF failures, this is what they tell us. My hormone levels are normal, my uterus is structurally normal, my embryos are of good quality, even the sperms are good, sometimes even genetically tested embryos were transferred, and yet pregnancy did not happen, or it happened but did not continue. So naturally the next IVF cycle is advised. But repeating IVF without identifying the cause of failure is like repeating the same exam without understanding why you failed the previous one. And here is something very important to understand. IVF helps in creating embryos, but IVF cannot ensure that the mother's body will accept the embryo. Because pregnancy is not just about implantation, it is also about immune tolerance. Pregnancy is a very unique biological situation. The embryo carries 50% material from the mother and 50% material from the father. Now, from an immunological perspective, this means the embryo is partially foreign to the mother's body. Now, normally, the maternal immune system develops tolerance towards this embryo and allows implantation, and then the pregnancy continues. But in some cases, this immune tolerance does not develop properly, and when it happens, the embryo may not implant, or the pregnancy may start but not progress. This may show up as repeated IVF failures, repeated miscarriages, biochemical pregnancies, or even complications later in pregnancy. Routine fertility investigations usually focus on hormones, ovarian reserve, sperm factor, uterine structure, tubal patency, embryo quality. But one crucial aspect often remains under-evaluated, and that is the immune system in accepting the pregnancy. In some women, there may be an underlying alloimmune imbalance. When the immune system does not adequately recognize or accept the embryo. And in such cases, simply transferring another embryo without addressing this imbalance may not improve the outcome. So instead of rushing into another IVF cycle, a proper structured immunological evaluation may provide valuable insights. Once we identify an underlying immune imbalance, we can offer targeted treatment. At Dr. Raut's Center for Reproductive Immunology, we use Imulate, our patented process of active immunomodulation, in selected cases which helps in improving maternal immune tolerance towards the embryo, followed by individualized passive immunomodulatory support during pregnancy or during embryo transfer. The aim here is not to replace IVF but to complement it by improving the chances of successful implantation and continuation of pregnancy. Because sometimes the missing piece in repeated IVF failures is not the embryo but immune acceptance. So, if you've had repeated IVF failures, unexplained infertility, repeated early pregnancy losses, before starting the next IVF cycle, it may be worth pausing and properly evaluating whether an underlying immune factor is affecting your implantation or pregnancy continuation. Investigating first may help you choose that right treatment strategy for the next cycle. You can call or WhatsApp us at +919833201522 or visit our website www.icprm.in. If you found this useful, please like, share and subscribe to our YouTube channel. Do share this with at least one person who may be benefited from this treatment. You may change their lives forever. Thank you for watching.